Today, I will walk you through the cancer patient's journey. This presentation will look at everything from diagnosis of cancer to treatment of cancer and to follow-up for cancer patients. Let's say you're not feeling your best. Something's not quite right. You may feel a lump in your body or a sudden pain, headache, continued coughing, or fatigue. These are a few signs of cancer. The next step is to visit your family doctor, general practitioner, or visit a physician at a walk-in clinic. Your healthcare provider will ask you about your symptoms and based on them, refer you to an oncologist to make a proper diagnosis. The diagnosis and treatment process is a long one and often includes a team of healthcare providers and their interprofessional skills. In order to make the proper diagnosis, you will probably undergo diagnostic imaging so we can locate whether or not there is a tumor in the body. Diagnostic imaging includes 4 main modalities that may be used in the diagnosis process. These are X-rays, ultrasounds, CT scans, and MRIs. First, let's focus on ultrasounds. An ultrasound uses a transducer to transmit sound waves into the body. As soon as the sound waves hit a boundary such as between the soft tissue and bone, they are echoed back. Then this information is recorded on a computer screen. Next, let's look at X-rays. In this modality, an X-ray beam passes through the body and depending on the density of material, a shadow is cast onto a screen in varying shades. Your bones, being denser, absorb the X-rays and appear as white. Soft tissues in the body appear as gray. Next, let's look at CT scans. This involves several X-ray images that are reconstructed by a computer to form a 3D image. It provides more detail than an X-ray. CTs can also use contrast for a more detailed image. In a CT contrast, it makes the digestive tract and the blood vessels more visible and detailed, so if there's cancer in these areas, a CT contrast would help in the diagnosis. Since the substance given needs to be excreted, it is important that before a CT contrast, the patient undergoes a test. This test involves creatinine and estimated glomerular filtration rate test. This test ensures kidney function is optimal and can filter out dye to be excreted in the urine. The last modality we'll talk about is MRIs. This is a magnetic field that causes the body's protons to align with it. When a current is transmitted through the patient, it causes the protons to lose their alignment. When the current is off, the protons go back to their alignment and in the process release energy. This energy is detected by sensors and the information collected is constructed into an image. Let's say you get imaging done and there is evidence for suspected cancer. How do we confirm it? Well, we need to confirm your diagnosis by further analysis, but we need to extract some of the mass's tissue first to get a more accurate diagnosis. How do we extract tissue to be analyzed? The answer is a biopsy. We'll need the help of a surgeon at this step. However, before we can get a biopsy, you'll need to undergo some tests first. We want to make sure the patient won't bleed after the biopsy is performed. The cells that are responsible for clotting blood and stopping bleeding are platelets. For platelet count, we need to order a CBC or complete blood count, and for the rate of blood clotting, we would order an INR or an PTT. Once that report comes back as okay to proceed, you will undergo a biopsy. There are 4 main types of biopsies: a fine needle biopsy, core biopsy, incisional biopsy, and excisional biopsy. In a fine needle biopsy, a small needle is placed in the tumor. Cells are withdrawn by aspirating the syringe and then are placed in a glass slide to be examined. In a core biopsy, a bigger needle is used to extract more tissue than an FNA biopsy. In an incisional biopsy, it involves removing part of a visible tumor. It will probably include local or regional anesthesia and may also involve stitches, depending on the amount of skin that is cut open. In an excisional biopsy, there is a surgical extraction of the entire mass, and if the tumor is inside the chest or abdomen, general anesthesia will be administered. Sometimes biopsies will involve checking the lymph nodes. To check for spreading of the cancer to the lymph nodes, the surgeon will perform a lymph node biopsy. Since lymph in our body flows in one direction, by checking the first lymph node, called the sentinel lymph node, The surgeon will know which lymph nodes need to be removed and will help with the staging of cancer. Now we will send the biopsy tissue for further examination. The person who analyzes the tissue will be the pathologist. The job of the pathologist is to analyze the tissue sample and to identify any cancer. They will run specific tests on the specimen, and there are three main ones: histochemistry, immunohistochemistry, and in situ hybridization. Histochemistry involves the staining of cells in the tissue sample and highlights tissue components in the biopsy. In immunohistochemistry, it involves antibodies, specifically the avidin-biotin complex, and the antigen that is specific to the tissue. And in situ hybridization, it helps us identify DNA abnormalities, and specifically helps us identify specific tumor markers that are found in specific cancers. After all the testing is done, the pathologist will make a report. The elements of the report include grading, staging, margins, prognostic factors, and predictive factors of the patient. Grade refers to the level of differentiation and growth rate of cells. When the cells are well differentiated, this means it is hard to tell if there is cancer. When they are poorly differentiated, it is easy to tell that there is cancer. We may be more familiar with this one. Usually when we talk about cancer, we hear stage 1 or stage 4 cancer. Stage 1 means the cancer is confined to the organ. Stage 2 means cancer is locally spread. Stage 3 means cancer has spread to lymph nodes. And stage 4 means cancer has metastasized. Margins are important, especially when it comes to surgical removal of the tumor, because positive margins put the patient at risk of metastasis. Therefore, surgical intervention is needed to produce negative margins so the surrounding normal tissue is unaffected. Prognostic factors play a big role in the outcome of a cancer patient. It depends on the stage and grade of cancer, depends on metastasis, and specific patient factors such as age, comorbidities, and ethnicity. Predictive factors predict the outcome of the treatment. They depend on the overall health of the patient and use assessment tools such as ECOG or the Karnofsky scale. Here is what both of these assessments look like. Now that the pathology report has been submitted and the cancer diagnosis is more detailed, we will now move on to treatment. There are many different types of treatment. Specifically, there are 6 types of main treatments used for cancer. The first type of therapy is chemotherapy. This involves drugs that kill cancer cells by preventing them from dividing. Examples include bleomycin, adriamycin drugs. Chemotherapy can be used as a neoadjuvant drug, which means before another treatment in order to shrink the tumor before surgery or radiation therapy. Concurrent means chemo is given along with another treatment, and adjuvant means chemo is given after a treatment. Since chemotherapy is a systemic treatment, it affects the whole body. Some side effects include fatigue, nausea, vomiting, mouth sores, diarrhea, and hair loss. The second treatment is radiation therapy, which involves administering the radiation dose to the site of the tumor. Radiation therapy can be given as an adjuvant treatment, which is usually common with breast cancer patients. Since radiation therapy is targeted, unlike chemotherapy, the side effects will happen at the site of treatment. The side effects include dermatitis, fatigue, and xerostomia or mucositis for head and neck cancers. The third type of treatment is surgery and involves the extraction of the tumor. An example includes a lumpectomy, which is for breast cancer. One of the main complications with surgery is when lymph nodes are involved. When lymph nodes are dissected, if cancer has spread to them, it can lead to lymphedema, which is when fluid builds up in a part of the body, since the normal drainage flow has been disrupted. The side effects of surgery include pain, confusion, risk of infection, bleeding, blood clot, and atelectasis. The fourth type of treatment is hormone therapy. It is used when cancers are hormone dependent. It involves synthetic hormones, which are used to stop cancer from growing. The side effects include fatigue, constipation, diarrhea, hair thinning, worse memory, headaches, mood swings, and depression. The next type of therapy is targeted therapy. This therapy involves targeting mutations on only cancer cells and not on healthy cells. However, it's important that the patient is first checked if they have the mutations to know if the targeted therapy will work on them. The side effects of targeted therapy include fatigue, nausea, diarrhea, hand-foot syndrome, and arthralgias. Lastly, we will talk about immunotherapy. Cancer cells can turn off the immune response checkpoint inhibitors. Immunotherapy prevents cancer cells from doing that, so the immune response can do its job and attack the cancer cells. The side effects of immunotherapy include diarrhea, pneumonitis, and hepatitis. So there you have it. These are the main treatments that are used for cancer. So now you may be wondering what's next after you got your treatment. Next is a follow-up. Follow-ups are important to make sure that there's no recurrence of cancer. Here is a quick summary of what we've covered so far. We started with an oncologist referral by your local healthcare provider. Then the process of diagnosis begins, which involves a team of healthcare professionals. Then they plan the treatment, and the treatment is given over a period of several weeks. And after the treatment, there is a follow-up. The process can seem exhausting and stressful, and cancer is difficult. It comes with anxiety, worry, and stress. It affects relationships. You don't feel like yourself, and it can make you feel alone. Though it is difficult, remember that you are not alone. Make sure to reach out to family and friends and let them know how you feel. And make sure to get in touch with a mental health specialist to talk about how you're feeling. They will give you a tool set to make your cancer journey easier and keep you motivated the whole way. Thank you for listening.